just to wrap things up here, I wanted to walk through some of the technologies that we're using in our dry eye studies that have contributed to pushing along the programs for the development of dry eye therapies. And I also want to share these with you because these are technologies that you'll probably be exposed to if you haven't already, and what to expect. So there's been discussion today about the controlled adverse environment. And what this is it's a room. And again, many of you have already experienced this, but it's basically a room that we can control relative humidity, temperature, airflow, and visual tasking in. And you ask the question, well, what does that mean? Why do we want to do this? Well, we do know that there's a lot of underlying causes of dry eye, but there's a lot of these influential factors that we discussed at the beginning of the talk. So with all these different influential factors, this can really complicate our interpretation of whether or not a drug's working. It creates what we call background noise. So if we want to control these environmental factors. And in any experiment, you want to control as much as you can and focus on just the primary endpoints. So this is our attempt to try to control influential factors. And we use it to basically have patients come in, and we screen patients with this technology, see how you react. We do use it as an endpoint in clinical trials. So we'll look at how do you feel in the chamber after using a therapy? How do your eyes look when you come out of the chamber? Are they more red? Do they have more staining? Different endpoints. But we've used this in literally over 10,000 patients over the past 15 years. So it's a very safe technology. It's become really the gold standard, one of the gold standard ways of evaluating therapies for dry eye. And this is being implemented in many of the phase 3 programs. So like I said earlier, there's not just one unit here in Andover that we run these clinical trials in. We've got mobile trucks, and I'll show you a picture of that actually. These are the mobile laboratories that will travel from one investigative site to the other. So we work with roughly 50 dry eye centers across the country, many in the Northeast, some down in the Southwest region, and even on the West Coast. So these trucks are traveling all around. So if you haven't seen them, you'll probably see them soon because we're building more actually.